Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I'd like to take a few minutes to discuss with you the use of MRI, or magnetic resonance imaging, for the detection of prostate cancer and for the management of prostate cancer. In this brief video, I will give you an overview of prostate cancer, how the diagnosis is made, and how the magnetic resonance imaging can enhance the diagnosis and is used to monitor or follow prostate cancer. Prostate cancer is the second leading cause of death in men following lung cancer. It is the most common cancer in men other than skin cancer, and 250,000 new cases occur each year and is the cause of 40,000 deaths in men in the United States. The diagnosis is made through a physical examination, a PSA blood test, and then a biopsy of the prostate gland, taking 6 to 12 random samples of tissue from the prostate. The magnetic resonance imaging, or MRI, is a test that uses a magnetic field and pulses of radio wave energy to make a detailed picture of the prostate and organs surrounding the prostate gland. The MRI images allow the physician to evaluate various parts of the prostate gland and determines the extension of the cancer in the prostate gland. So who are candidates for prostate MRI? Men who have an elevated PSA level is one. Secondly, men with elevated PSA level and a negative ultrasound or ultrasound-guided biopsy is another. Men with a positive digital rectal examination and a negative biopsy. Men with a confirmed diagnosis of prostate gland and want to exclude additional cancer or extension to nearby organs. And also men who have been treated for prostate cancer when there is concern about a recurrence. So how is the MRI used to help diagnose prostate cancer? By using biopsy guidance, it can more precisely target suspicious lesions and even very tiny or small lesions to allow for a more accurate sampling of the prostate gland. The MRI is useful after the diagnosis of prostate cancer to determine if it is localized or extension beyond the confines of the prostate gland. Also, it can be used to detect very small lesions when recurrence is a concern. How is the procedure performed? The man will lay flat on a table. A small device capable of sending and receiving radio waves are placed around the prostate gland. The patient is then moved into the magnetic resonance system and given an IV of an iodine-containing material that is used to help identify suspicious lesions. The exam lasts about 35 to 45 minutes. The risk and complications are it does not utilize exposure to ionizing radiation. It poses no risk when appropriate safety guidelines are followed. There is a very slight risk of an allergic reaction to the iodine. The MRI is covered by most insurance companies if prior authorization is obtained. For the cash-paying patient, it is approximately $800. In summary, prostate cancer is a common cancer in men, affecting 250,000 men each year. The diagnosis is easily made with a PSA blood test, digital rectal exam, and a prostate biopsy. If the biopsy does not confirm prostate cancer, additional testing using magnetic resonance imaging is indicated. I hope you have found this useful and helpful. If you have any questions, contact your physician or go to my website, www.neilbaum.com. Thank you.